Welcome back to the conversation. We'll now be shifting gears a little. We'll be speaking with Mr. Gregory Arneaux, founder and clinical director of ISD Health Solutions. We'll be looking at the critical issue of sleep disorder, exploring their impact on health and well-being, and sharing insights on effective management strategies. How are you, Mr. Arneaux?
I'm well, thank you.
So, sleep. There are a lot of things to consider, but if we're being brutally honest, we just see sleep as a necessity. We don't pay much attention to it. We just know that it's best to get 8 hours. How much more do we need to know than that?
A lot more to sleep than just 8 hours, I'll be honest with you. Sleep, as you can see, if you're not getting proper sleep, it affects your day, right? You'll feel tired, you don't have the energy that you need to get by sometimes. Most often you might find yourself dozing off at some inappropriate times, like even while driving or at work. But the idea that sleep is more or less kind of like a tune-up that we need every night, kind of like taking your car. If you don't change your oil and you just keep driving it all the time and never do the maintenance that's required, it's going to break down. And that's what happens when you don't get proper sleep, meaning the quality of the sleep as well as the quantity of sleep is important.
So how do we differentiate? How do we ensure that we get proper quality sleep vis-a-vis just the quantity of sleep?
Good. So one thing you can measure is quantity, right? You know what time you may have fallen asleep and what time you wake up by your alarm. But what you can determine is the quality of that sleep, which can only be found out by you doing a sleep study test. So having information about your heart rhythm, your oxygen level, understanding if you're getting through this natural architecture of light sleep, deep sleep, and REM sleep without having it fragmented, will all determine what kind of quality of sleep you're having. So sleep studies are now what you'll have to do in any case to identify if you're getting good sleep quality.
So you stated earlier about you getting a tune-up, that's what, a daily tune-up, and you draw the allusion to a car. What are some of the long-term implications, though, for getting poor sleep? I recognize that during our early conversation, you would have been described as a sleep apnea specialist. What does that mean, and how does that corroborate to the whole idea of quality and long-term effect?
Well, I am a respiratory therapist for the last 25 plus years, and sleep apnea is a sleep breathing disorder. It's an issue when you're not properly...
That's when we're snoring?
That's when you're snoring. That's one of the symptoms, obviously, of sleep apnea is snoring, but not in all cases because there's two various types of sleep apnea. One is obstructive sleep apnea, which is an obstruction that takes place in the back of the throat area, typically collapsing that airway space and limiting airflow in, or completely cutting off all air supply. And if it exceeds more than 10 seconds or more without you having taken a breath, that's called apnea. The other side of that is it's called central sleep apnea, which is a little different from obstructive sleep apnea. Neurologically, the brain is not signaling to the diaphragm to engage the muscles in breathing. And that is a different type of situation because there's no obstruction involved and no rattling or having any snoring as an indication. So this is a more serious condition that requires a different type of technology and how you treat this.
So based on your description just now, that central thing, it sounds like it is where you forgot to breathe. So your body technically forgets to breathe.
Exactly.
Is that it?
So we don't think about breathing, right? It just happens involuntarily. We don't have to think about it. We just breathe, right? But imagine if that mechanism, which is the brain signaling to the diaphragm, takes the night off like you are, right? Trying to get some rest. Those pauses that you don't take that breath, that's called central apnea.
What causes that, though?
Neurological problems, most often in the brain. If you have neurological issues, it's a main concern. But if you're also obese, you have a lot of weight around your neck and the back and so forth, that signal obviously gets broken and it's not able to get to the diaphragmatic muscles based on positions that you're sleeping in as well that could affect that.
Wow. So you also have a book out, The Wake Up Call.
Yeah.
You know, How You Sleep is How You Live. Tell us a little about that and what are some of the issues that it seeks to address?
Wow, the book, was inspired by me realizing that there were so many people that were living with problems in sleep and had no idea that they could be solved. One, there were solutions to treating it, but more importantly, my family was affected by it because my grandmother snored like a bear, just like most families may have somebody in their family they joke about. But my grandmother, from what I remember, was the only person I first learned about snoring from, right? She would come and spend some weekends and holidays with us in Miami where I grew up. And my family's from Trinidad and Tobago.
Yes.
And she would snore the place down, Kwame. Like I'm telling you, you would hear it from rooms on end. But the idea was that I thought it was a joke. You know, my brothers and I would chuckle about it and make, you know, all these things, humorous, you know, jokes. But the thing was that later on, as I became an adult and became a respiratory therapist, I realized that that particular snoring was a sign of a more deadly situation called sleep apnea. As I watched her health deteriorate over time with her weight and her blood pressure, eventually getting dementia as well as glaucoma, I realized that so many people, especially in the Caribbean, don't even have an idea of how serious this is, because snoring is part of the culture, would you think, you know? Snoring is just part of life, we think, in most cases, but habitual snoring is something that definitely needs to be addressed.
Well, I think the issue for many of us, though, is that when we're younger, we typically don't snore, but as we advance in age, then we begin to snore, and so it seems as though this is something that happens when you grow. As you grow older, you snore.
Can I correct you for a moment?
Definitely.
You can snore as a child. You can have sleep apnea as an infant.
Those persons would just say that they sleep bad or something.
Well, say children who have undeveloped airways and may have enlarged tonsils or adenoids may be crowding that airway space, not allowing the oxygen to get in, and also suffer from sleep apnea, which leads to memory learning difficulties, weight gain, all kinds of ADHD and problems. Now, if they have surgery, most often ENTs play a role in that particular area by removing the tonsils or adenoids to create that airway space necessary for them to breathe properly and allowing them to be able to get the proper rest. You know, so we think that snoring is an adult problem. It's not. It's not a gender problem. It's not a height problem. It sometimes could be related to weight, but not in all cases. You could be skinny like you and I and snore like a pig. So it all depends on more or less who you are and what the structure of your airway looks like while you're sleeping that affects this.
So I was skimming through little sections of your book, and something struck out, and I can appreciate, well, as a man, you should be able to appreciate also that there's something that you spoke about, erectile dysfunctions being linked to poor sleep. Unpack that a little bit.
Well, during this REM sleep stage, where our mind is very vivid and we have dreams, our body is temporarily paralyzed, and there's a number of things going on. First, our hormone regulation of our leptin and ghrelin that control our appetite to know when we're full, to know when it's time to eat, and our metabolism rate. So if you're putting on weight, most often it's because you're having poor REM sleep. And for men, this is the time that we are actually having the highest level of testosterone development. We have a penile erection during this stage of sleep. It's not because of a thought or erotic dream. This is a function that's supposed to happen to ensure blood flow and the capillaries stay firm and allowing us to be able to sustain erections. And most men are experiencing these problems and obviously not addressing it in the right way by taking pills or other types of solutions. But the issue is relying on what's happening in their sleep. And if you fix that problem, the game changes in the bedroom, and it's not just about the snoring.
So gentlemen, we need to pay attention to the fact that, you know, it's a little bit more than snoring that might be causing poor bedroom management.
Well, women are affected too now.
How though?
Well, women also snore. I mean, it's not sexy, but it happens. And the thing is that women's libido gets affected, and women are a little different from men, as we know, and women's sleep is also different. So their symptoms and how their sleep is impacted is a little different from men. They may not snore. They may just be having complications of moving back and forth, especially during pregnancies as they're putting on a little bit of weight and getting a little more difficult to get to a comfortable position. But their menopausal issues and hormonal imbalance takes place most often because of what's going on in their sleep. And women lose their sex drive, they start putting on a few pounds, they don't feel as desirable anymore, and they don't always have a headache, but they just don't feel like it because at the end of the day, they're tired, right? They're worn out.
So what I'm to understand from all that you have said is that sleep is just more, it's definitely more than just going to bed and lying down for 8 hours. It's definitely a tune-up, and that's an oversimplified version, obviously, of what you have just said. But what else can we expect? How can we fix some of these issues that we are having? Well, first of all, how do we even get to find out about some of these issues? And I'm sure that you're going to tell us that hopefully you would have had your practice here, or you're planning on having one here, or something to that effect.
So I'm working with a few physicians here and also some pharmacy groups. Fontana is going to be able to now take the social responsibility and help the public understand that sleep apnea is real. Until you lose a loved one or someone that you care about, at the end of the day, you probably not even consider why you'd be looking at your sleep, right? But if you are needing to get some evaluation in sleep, it starts with a sleep study test. So we have a device that we're going to allow persons to be able to access and take to their home in the convenience of their own beds and sleep and record their heart rhythms and oxygen levels and monitor how many times they maybe stop and start breathing throughout the night and how that fragments their sleep architecture. This determines the quality of your sleep and if the severity of sleep apnea is necessary to treat. Most persons would probably say that they have a new Fitbit watch or have a ring or something that's monitoring sleep or sleep tracking. Those are nice consumable devices, but not medical grade devices. At the same time, a good way for you to learn a little bit about your sleeping habits and be able to be informed that you may need to seek medical attention. But most often, if you just have your cell phone and just put it by your nightstand and turn on recording, you'd probably realize you're saying a lot, doing a lot, moving a lot, and maybe be more aware as you understand that, you know what, I may not recall what happens in my sleep. Bedside partners would probably tell you a lot more what's going on. But this technology allows us to get some insight, but it all starts with an actual test and under the medical supervision of the process of you understanding what sleep is and what to do. We can provide those solutions now here in Jamaica.
So Ceen, so one, we know that you're going to be partnering with Fontana Pharmacies, all 7 locations to push the book and to talk about. Outside of that, how will we access information as it relates to you and your practice here?
Well, that's easy. You go to our website, isdhealthsolutions.com/Fontana, and you'll get on the landing page there where you provide us a little bit of information about yourself, help us to understand what some of those symptoms and issues you may be dealing with. And then you schedule a free consultation virtually. So you don't have to leave your house, you don't have to go anywhere. Get on the phone on the time that you decide that you would like to be contacted, review the information that you've submitted, and then start the journey of understanding if a test would be the best option for you to start with. We'll give you the product, which you place on your finger and go to bed with it, sleep with it for a couple of nights, because you do sleep differently every day. There are no 2 days in our life that are the same, and no, there are 2 nights. And we review that information with you once a board-certified sleep physician accredited by the American Academy of Sleep Medicine has the ability to review it and provide some recommendations of treatment.
Oh, so we'll keep that for a couple of nights, and when we're finished, we'll return it to you.
No,
or
it's
the
disposable.
information is.
So it's a one-person use.
How do you get the information, though?
So the information works with an app.
Okay.
Come on, technology. Everything is working with an app today.
You download the app, and then you can always access the information.
That's correct. It gives you about 7 nights of information, so you can record your different patterns of sleep. Obviously, if you're drinking alcohol or taking medication, or obviously you want to be able to see how it's impacting, this is a great time to see the differences of how it affects your sleep architecture.
Okay. So lastly, though, as we wind down to the end of the conversation, you also stated, because there's a lot that we spoke about before even actually being here, you stated for the record that there were over 80 different kinds of sleep disorders that affect our sleep architecture, as you call it. Again, we want to find out how far-reaching are those implications negatively on our health.
Everything that we deal with in our life is predicated on how well we sleep. I mean, the book, The Wake-Up Call, was built around how you sleep is how you live. I mean, this is a wake-up call for a lot of people. We don't realize that sleep impacts our weight, our blood pressure, our sugar levels, our mental health, anxiety, depression, Alzheimer's disease, dementia, erectile dysfunctions we've talked about, the motor vehicle accidents. Our athletes need to sleep to be at their best to perform. Our students need to be well rested to be able to do well academically. We need, as adults, need to be well rested to be able to manage our responsibilities of our day and take care of our children. These are all things that are going to affect us. So 80 different types of sleeping disorders is a lot, but most common, or the most known, are insomnia and sleep apnea, right? Insomnia, when you have a difficulty to fall asleep or a difficulty staying asleep, this is what insomnia is. And there's a combination of, most often patients who have sleep apnea also have insomnia.
Yeah, I was about to ask that question too. But so you're also saying, though, that so little Johnny comes to school, he has problems with ADD or ADHD. That might also be attributed to the fact that Johnny has a poor sleep architecture. He either has sleep apnea or insomnia, or a combination of both.
Correct. So as the 80 different types of sleeping disorders, from insomnia, sleep apnea, bruxism when you're grinding your teeth at night, periodic leg movement or restless legs, you're kicking your legs and you're moving around in your sleep, paralysis, sleep paralysis, where you're...
Well, I guess we call that one, when you're moving suddenly, we just see that as a spasmodic jerk. So you just, something just happened.
Those things are actually disrupting your sleep quality, once again. You can have shift work disorder. You can have sleep talking, sleepwalking, You can have issues with all types of sleeping problems, but the only way that you can get a grip of it is first having a sleep study to determine what's going on. So there's no way that you can figure it out if you're sleeping well or not. It's kind of like me trying to figure out what your blood type is by looking at you. I can tell that you got blood, but I can't tell what the type is. So the same with your sleep. You don't know what you may be dealing with and what possibly can be adjusted in your lifestyle to help improve your sleep. One of those things is putting that phone down at a good time so the light's not affecting us and our brain gets
the blue light.
The blue light. Our brain needs to rest, right? Our brain needs to kind of detach away from all the responsibilities of life and everything that we do every day to be able to get into this peaceful state of mind so that we can get a good night's rest.
Wow. So that's a lot for us to consider, though, and we just want to start off by saying that we hope, we wish you all the success, and we hope that persons will actually be paying more attention to how we sleep.
Yes.
We just spoke to the author of the wake-up call. How you live or how you sleep is how you live. So we want to take this opportunity to thank you for joining us on the conversation. We have unpacked critical issues surrounding the by-elections, the integrity of our political system, and the future of representation in Jamaica. You have heard the input of our expert guests, Dr. Nadine Spence, Kevin O'Brien Chang, and Jermaine Barrett. Also, you just heard, as you would have seen, from the sleep specialist himself, sleep apnea specialist, Mr. Gregory Arneaux. Thank you for watching Ceen. Continue to do so with us, your preferred eye to the Caribbean.